Hi, this is Dr. Edwin Yau with iCare Medical Group and icaremedspa. Today I wanted to talk about a specific concern that affects most of our patients, whether they realize it or not. As we age, patients, men and women, both experience genital urinary symptoms, including urinary frequency or even urinary incontinence that are related to stress incontinence, mixed incontinence, and even sexual dysfunction. All of this can be tied down to one specific root cause, and that is weakening of the pelvic floor muscles. Up until recently, we physicians as a medical community, we had been advising patients to do kegel exercises at home. And kegel exercises are muscle contractions that you do yourself on your own, and we would tell patients to do hundreds of them a day. And if any of you have ever tried kegel exercises, they're exhausting. And number two, they're boring. If I asked you to do 100 kegel exercises, you'd be pretty tired and you would not be able to keep up with it over the long term. So I've never actually in my entire career found a patient who could actually adhere to the kegel exercise regimen that we recommended. So enter a new technology. It's called Emsella, which is designed by a company called BTL. We really love this technology. It's a high-fem technology that delivers energy to hypercontract and exercise the pelvic floor muscles. Within a 28-minute period, we're able to induce over 11,000 high-quality kegel exercise contractions in our patients. And it's really wonderful because it's very time-saving. There are no side effects. It's very well tolerated, and we recommend that patients undergo this once a week for a total of 6 weeks. I find it extremely gratifying because I have had patients who were dependent on diapers, and after a total of 6 treatments, were able to regain their confidence because they no longer required diapers. They could go out into the public or go on trips and not have to worry about incontinence. One tidbit about this is that a lot of my patients have also experienced a significant improvement in sleep. As we get older, both men and women, you'll find that patients will get up more frequently in the middle of the night to use the restroom. And after using Emsella, they have to get up less frequently, significantly less frequently, oftentimes not needing to get up at all. So this is another area that really improves the wellness of the patient. If you have good sleep, that improves your immune function, it improves your stress level, it has cardiovascular benefits just by being able to sleep uninterrupted. So this technology really has very broad, wide effects. It is really a quality of life treatment, and I prefer to use it as a preventative measure. I don't think that it's wise to wait until someone develops incontinence before actually implementing these types of treatments. In fact, I really recommend that everyone should get 6 treatments at least once a year to just maintain their pelvic floor health. So that's what I think about the Emsella technology and how it relates to urinary incontinence and urinary frequency and sexual dysfunction.